Hello, I am Lisa Butler, the Executive Director of the GBS&CIDP Foundation, and I'm joined today by two of my poster co-authors, Drs. Peter D'Onofrio from Vanderbilt University Medical Center and Wendy Terrell from PlatformQ Health Education. This poster was accepted at the 2020 American Academy of Neurology annual meeting. Although the meeting was canceled due to COVID-19, you can view our poster on the online meeting section of the AAN.com. We're happy to present this poster to you today through this video presentation. As with many rare conditions, awareness and education can be challenging. And we created this program to help with more accurate and timely diagnosis of Guillain-Barré syndrome and chronic inflammatory demyelinating polyneuropathy in the hospital setting. Clinicians are challenged to differentiate CIDP and GBS. CIDP and GBS can have similarly acute presentations. Therefore, accurate and timely diagnosis is an integral component of patient management. This includes monitoring during recovery from acute onset and appropriate referral. We sought to assess the influence of online continuing medical education, or CME, on addressing clinician gaps and on recognition of the management of acute and chronic inflammatory diseases.
Yes, my name is Dr. Peter D'Onofrio at Vanderbilt University. The title of this program is Improving the Recognition of Guillain-Barré and CIDP in the Hospital Setting. The format was a 1-hour video, continuing medical education activity, produced and broadcast live and then converted to online in September of 2018. It was then made available on demand for 18 months following the live session. The activity featured downloadable educational slides, panel discussions, live polling, and a live question and answer. Learners were encouraged to submit questions before and during the live program, and you'll see some examples of that in a minute. So here are some of my colleagues who participated in this educational endeavor. Roy Freeman is a professor in Harvard Medical School at Beth Israel in Boston. You see my name. Mark Perlmutter is at Tufts University in Boston. You've already heard from Lisa Butler. And then John Chandler is at the White Plains Hospital and Montefiore Healthcare System in New York. So what were our learning objectives in setting up this educational program? Importantly, we wanted to emphasize the signs and symptoms that may suggest a patient has either an acute or chronic inflammatory neuropathy, so either Guillain-Barré or CIDP. We wanted to formulate a differential diagnosis for acute onset CIDP from GBS. So we know that about 5 to 15% of people with CIDP have an acute presentation that can look a lot like Guillain-Barré. We wanted to educate our attendees to recognize the electrodiagnostic testing features that are characteristic of immune-mediated demyelinating neuropathies, and we'll see an example of that in a minute, and identify points of referral for patients with immune-mediated demyelinating neuropathies such as Guillain-Barré and CIDP. I'd like to credit Albert Einstein College of Medicine and Montefiore Medical Center for being the accredited providers for this educational endeavor.
Hi, I'm Wendy Terrell from PlatformQ Health Education, and I manage the evaluation for this program. So as you can see on the right side, we had a survey-based evaluation approach. We had a pre-test right before the program, an immediate post-test, and then a follow-up post-test, which was 2 months following the education. So we took the results from the questions posed during these 3 surveys, as well as responses to the live polling and the trends in the questions that came in from learners to ascertain the impact on the education. Okay. So we could see who came to the program. There were 693 learners in total, and 527 of those were physicians, NPs, or PAs. And 68% of the total audience were members of the target audience groups, which are listed at the bottom of the slide. There were over 100 slide downloads and over 263 CME credits awarded. So at that 2-month follow-up survey, we were able to ask some behavioral questions about the impact over time of the program. And 65% of respondents reported that they did observe a positive impact on patients. Some write-ins, there were 38 write-in examples of changes, and we list 4 of them here on the slide, including earlier diagnosis, better prognosis, patients being more pleased and satisfied with the prognosis and the treatment options. And we also posed a question to learners at 2 months following the education about impact on their clinical practice, and 80% of respondents did report there was a positive impact that they tied to taking part in the educational program. There were 50 write-in examples shared, and we have 4 that are listed on this slide as examples here, including improved use of IVIG, adding new techniques in symptom identification, faster diagnosis and treatment.
So when we look at the results and the changes in knowledge and competence, 3 out of 4 knowledge and case competence questions reflected statistically significant improvement on testing of acute disease, treatment choices, and the referral pathways. So let me direct you to the left side of the slide, and you see the results for what agent provides the greatest short-term benefit. We see the pre-test results, the post-test results, and the follow-up. The purple vertical line is IVIG, green is oral cyclosporin, orange is dexamethasone, which is a steroid, and gray is oral prednisone. And you can see that after taking the course and the testing, people not only recognized that IVIG was a superior treatment short term, but there was an improvement after the test. If I direct you to the right, we even educated our patients and healthcare providers on one aspect of nerve conduction testing. And nerve conduction studies are done in the hospital to evaluate whether a person has either AIDP, which is a form of GBS, or CIDP. And you can see that after the performance of the testing or the course, that more people knew that a prolonged F wave is seen in people, particularly with early onset Guillain-Barré syndrome. So in summary, people now recognize that IVIG is the best and short-term treatment, and we also educated them a little bit in nerve conduction testing.
So we saw some very positive results from this, and we also identified some areas for potential future programs. The quantitative testing and surveying supported the positive impact of this CME, which was focused on improving awareness of GBS and CIDP in the hospital setting. Questions posed by learners indicated interest in patient characteristics, testing, first-line treatment, and treatment in consideration of other comorbidities. Ongoing education could include differential diagnosis, circumstances for repeat testing, comparative assessment of safety, efficacy and tolerability of treatment options, first-line treatment options, and managing treatment outcomes. My name is Lisa Butler. Thank you so much for viewing our poster.